Smoking cessation is one of the highlight thing that you have to know for the step 2, and they'll always ask about the treatment, the different conditions, like when do you use what drug, when do you have to include this drug. That is very important. And for smoking cessation, you have two parts. One is pharmacological treatment, and one is a behavior counseling. For behavior counseling, that comes in the ethics part, where you do a motivational interviewing to the patient, and you try to find out where the patient is, at what stage of quitting, whether did he start or did he fail. Based on that, you talk to the patient, do motivational interviewing and all of that. But when it comes to the pharmacological treatment, you have three drugs that are very, very important. That is nicotine replacement therapy, bupropion, and then varenicline. So these are the three important drugs that you have to remember. So first thing that you go for is always which is effective treatment is NRT. So nicotine replacement therapy. So what do you give in this is, one is combination of long acting and short acting. So you should always remember, when you give both, only it is like more effective. It's not either of them. So to have more good good improvement, then you have to use both together. One is long acting and short acting. In long acting, you will have nicotine patch. In short acting, you have this nicotine gums, lozenges, nasal spray. These three are there, so that you can, this long term will these both are used for decrease the cravings and withdrawal effects, and there are no side effects. So he might give a question about like, he has a chronic smoking history and he wants to quit, and you put them on this long-acting NRT, and what is the best next step? So it's not like you don't give any treatment because he's already on the nicotine patch. You have to add the short-acting drug. So then you have to like add these gums, other things. Next, bupropion. Bupropion is we already read more about that in antidepressant. This is an antidepressant drug. So, and this is also used in case of smoking cessation. So usually, when do you give this drug? Normally, you go for NRT, but when the patient who is already a chronic smoker, who is already a depressed patient, he's having depression also. So to treat the concurrent depression, you give this bupropion. In that case, you would go for this drug. So when compared to NRT and varenicline, this is less effective, and this also has some side effects. So after stopping of this drug, there is a decrease in weight gain. So if somebody has already had this eating disorder, they will be having low BMI. So you don't want to put them on this drug, because there is decreased weight gain. And in history of seizures, a patient who has history of seizures also, you don't give this drug. So this has a contraindications. So side effects is decreased weight gain and contraindicated in this eating disorders and seizures. So there might be a question about this one. He gives a smoking history and with a depression history also. So this is the best drug in that case. Varenicline is also, this is compared to all three, this is the most effective drug. This is a partial agonist of nicotine receptors. So this is very best in the long-term case, but it is costly drug. So this is also given. Next, this has some side effects like sleep disorders and abnormal dreams, all of